Thanks, Brett. Good afternoon. Yesterday was a very sobering day in terms of our battle with coronavirus. The two people who passed away, two Victorians who passed away, one, a woman in her 60s who was in the second week of her infection and was being supported by one of our health units, passed away at home in Hume. The second individual passed away, a woman in her 40s, passed away in the city of Darebin. She was confirmed as a COVID case by the coroner. It's been since we haven't had a fatality here in Victoria with COVID since the 18th of October last year. We have 120 new cases. It's the 2nd of September last year that we got anywhere near that kind of number in terms of daily caseloads in Victoria. Now 900 active cases in total, 895 local community cases active in Victoria. 2/3 of those cases are under the age of 40, with 187 of those cases under the age of 9. This continues to be an outbreak impacting mostly younger Victorians and younger and more active Victorians. There are 58 people in hospital. Of those, half are under the age of 50. 2 are infants under a year old, and 2 are children aged 10 and 11. There are 21 people in ICU, 14 of those on the ventilator. In terms of the 120 active cases, 5, as been indicated earlier by Brett, are linked to the outbreak in the city of Shepparton. 1 is in Seymour, but linked to a workplace exposure in North Melbourne. 1 is a household primary close contact in Geelong. And there are 6 cases in the inner southeast around Richmond, Hawthorn and Alphington. There are 53 cases in our northern suburbs. Particular clusters around Campbellfield, Roxburgh Park and Gladstone Park. And there are 54 cases in our western suburbs, with around 16 around Altona North. There are 3 in Newport and another 7 in Hoppers Crossing. That makes up the 120 cases for today. Since the 4th of August, we've had over 30,000 Victorians isolate as primary close contacts, and they've done a phenomenal job in terms of slowing down and minimising the spread of coronavirus over the last 4 weeks. We've seen 1.25 million tests undertaken, again, to allow us to identify where the virus is spreading in our community. 56,000 of those tests were done yesterday. 99% of those results were available the next day. We've seen 1.5 million people get vaccinated, about half of those in our state clinics. We've made over 1,500 home visits, again, to people isolating and doing the right thing. 26,000 home visits in total over the 4 weeks. So collectively, that entire effort has all been part of holding down this Delta outbreak here in Victoria. It's the difference between the 895 active cases we have today rather than the 6,000 odd indicated by the Burnett modelling. And it shows in terms of the passage of the outbreak thus far. The original seeding in Newport and Caroline Springs and Melton, the move through our major schools around the west and north, the outbreak in Glenroy, in St Kilda, and more recently in Shepparton, and then the links into some of our most important hospitals, including the Royal Melbourne Hospital. All of those outbreaks have been brought under control through the really aggressive combination of test, trace, isolate, and the phenomenal work by all the individuals involved, the communities involved, the individuals involved, and the support agencies to make sure people could do the right thing and isolate effectively. In Shepparton now, we still have 6,300 primary close contacts. Day 13 testing starts tomorrow. We expect many of them to be cleared over the coming days. And in fact, in the last couple of days, we've cleared 3,000 of our primary close contacts through that day 13 process. There are still 13,800 Victorians that are isolating. 8 out of 10 of those have already returned a negative test result. So all the fundamentals remain in a really strong place. And every single spot fire we've seen in places like Shepparton, St Kilda and elsewhere has been dealt with and mopped up as we always have. What we are now challenged with in the days and weeks ahead is we continue to see very deep clusters of community transmission, particularly in places like Altona North, and in Broadmeadows, and in Truganina. And what we're dealing there is that every workplace, every retail setting, and every community meeting place has a much higher level of risk because of the level and the complexity of the change of transmission we see in those areas. So I'd like to give my thanks to all the community leaders, the civic leaders, the many people we've seen across the spectrum who are working with us in those communities today and we'll need to work so hard over the days ahead to make sure we continue to hold down that level of community transmission and support those people in those areas to ensure they can isolate and isolate safely. But it also highlights the importance of not allowing community transmission to spread into other parts of our state. That's particularly important when we see continued small seedings to places I've mentioned today. When you've got individual cases in Geelong and in Hawthorne and in Richmond, it's really important that we stay on top of those right from the get-go. So it means that for all Victorians, it's really important now that we all maintain that vigilance, that we test on symptoms, not the day after or a couple of days later. We test immediately when we have symptoms, that we isolate if we're asked or told to do so, and that we all play our part in getting these outbreaks as much under control as we need to in order to look forward with confidence to getting some freedoms back over the days and weeks ahead. So we can still slow this one down. We can still protect our communities. And if we keep working together, we can look forward with confidence to the weeks ahead. I'll hand back to the Premier.